As artificial intelligence becomes more deeply embedded in our lives, healthcare stands at the forefront of one of its most meaningful transformations. I have the feeling, and I assume you maybe agree. So yet in the quantum age, the challenge is not only to make AI more powerful, but also more secure, ethical, and decentralized. This word will follow us probably in the next couple of months and years. So I think Reto is on the right path with his vision for Crypto Mountain and decentralization. So please join me in welcoming Antonio Pesqueira. He's a researcher at INESC INOV in Lisbon with exciting insights to current challenges, the state of the AI in healthcare, and future opportunities. Applause for Antonio.
All right, good afternoon everyone. So I'm going to be speaking about the healthcare and actually making the connection of decentralized AI and healthcare. We have been already discussing a little bit about the healthcare and the importance of the healthcare data, but I'm going to go a little bit deeper in terms of some of the connections that we have from the people side, the technology and the data and the industry of healthcare connected with pharmaceuticals. So I have been working over the last 20 years in pharmaceuticals, but over the last 5 years, mainly dedicated in hospitals in terms of operations, clinical trials, decentralized clinical trials, and several different areas connected with data as well. Now, when we think about healthcare, not always we think about patient data, protection, privacy. Usually we think about our hospitals, or clinics, or appointments with our medical doctor, or lab results, and so on and so on. Now, healthcare data usually is very much connected with sometimes not our full protection in terms of what is our ownership of our own data. Especially when we are thinking about going to a medical doctor appointment, we are generating several different data points. And the big question that we should ask ourselves is, do we control our own data? Do we have that ownership that belongs to us or not? Now, a couple of numbers, and these numbers that you are seeing are connected with UK from 2024, is 160 billion British pounds. It's the total investment from 24 regarding the spending of the governmental resources in healthcare. 40% it's governmental spending only in healthcare, and 10% of the healthcare spending it's connected from GDP. Now, what we see there as well is the numbers, they are increasing tremendously. And actually, when we look to 26% obesity, 5.5% diabetes, those are not big numbers, comparing with, for example, US. That is the representation of how many patients are connected with those chronic diseases. And those chronic diseases, actually, they are increasing, and they are connected with the lifestyle that we have as well. And if we looked at 70% of those costs, they can be have a different perspective. They can potentially have a different understanding, and we can look from a different side. Now, healthcare connects as well with, of course, the increase of the costs because of the aging population. The elderly population, it's increasing, and automatically the costs, they are connected with that as well. And then, of course, the rise in medical costs connected with all the precision medicine, gene therapy, and so on, because our demanding of having better care increases as well. Now, when we start looking a little bit more deep regarding all the different points that we have connected with our own data, we start going a little bit more in terms of electronic healthcare data records. We go a little bit more in terms of the sensors, the data collection from wearables, and every time we interact with an hospital, with a clinic, even with a pharmacy, automatically we are generating data. And the volume of that data, it's increasing. And that brings a little bit more pressure as well. Mainly because if we want to decentralize, we need as well to increase the protection, the privacy, and having the technologies that allow us to release the data according to our own ownership. Now, the barrier, as we know, healthcare, it's very much connected with the regulatory pressure. It's very much connected as well with several different policies that are very strict every time we are transferring some data to another data set or one point to another point. And mainly, even if we are speaking about AI, even if we are speaking about blockchain or data management technologies, we need to understand that the importance in healthcare, it's really about the data. And the protection around those data from the different member states, and in Switzerland as well, when we look to the Federal Data Protection Act, we always need to keep in mind that the data privacy, it's very sensitive, because we are speaking about individual data connected with the patients, that it's us, right? Now, on the other side, there is a prediction, an estimation from WHO that there is a shortage in the next 5 years of more than 10 million healthcare professionals. And if you look at that, the costs are increasing from one side. From another side, the shortage in terms of healthcare professionals, it's also increasing. And automatically, we need to have a different way, not only to protect, to have privacy on our data, but also in terms of really anticipating what is going to be the automated understanding of how can we bring more agility to our processes connected with healthcare. Now, even in hospitals, if you start to think, one public hospital, let's say in my home country, Portugal, you have more than 20 different departments. Each of those departments, dermatology, cardiology, and so on, they have at least per day, per minute as well, you have more than 1 million data points being generated. Or because from a diagnostic perspective, or monitoring, and so on and so on. Now, there is a paradox, right? And the paradox here is probably AI can increase as well the automation capacity and the alleviation capacity as well in terms of accelerating what might be admin work the doctors might be doing, and probably they can focus more in also in other areas. And that is definitely one possibility. But on the other side, as more we have AI being implemented, we need as well to have really sure that the governance, the safety, and the compliance is always there. And the regulatory, it's not something that we can forget when we are speaking about individual data records like patient data. Now, if you look to this slide, we have kind of a paradox here again, right? How much can we centralize? How much can we decentralize as well? And that is not always a very easy question to make, right? And those discussions can go very differently regarding the different perspectives that we have on those discussions. If we are representing the policies, the government, if we have a central representation of our own interests, automatically we can assume, all right, probably we need to centralize. And the centralization of the data automatically brings more power, a monopoly as well, regarding a couple of software providers. Every time you go to an hospital and you have electronic prescriptions, there is always 2-3 software providers controlling all of those data points, right? We discussed already a couple of big giants from the technology side, right? And they have right now most of the control of our own data from a patient perspective, right? Now, on the other side, decentralization, from a cybersecurity perspective, can help us quite a lot. Because if there is a cyber attack, that if you have a Google search, you will see the numbers are increasing massively. The number of cyber attacks to the hospitals in Europe, the number is quite frightening. And automatically, if you have all the data centralized in one single point, you know the risks, right? And that is not a desirable situation that we want. Now, right now, some of the use cases that are being more important to the industry and connected with the research that we are doing and some of the pilots that are being implemented goes very much in terms of the medical imaging, meaning X-rays from a dermatology perspective connected with skin care, for example, and so on and so on. And there, AI can help us tremendously to detect patterns or from the skin or from the X-rays that from a human lens's perspective, it's a little bit more difficult or takes more time. Or you need the medical doctor expertise to really go with his or her knowledge to understand from that X-ray what is really the information most important with that diagnostic activity. Now, on the other side, the drug discovery. Because on the drug discovery, from an R&D perspective on the pharmaceuticals, what we have is more the capacity to have large data sets being analyzed from AI and having the humans in those loops as well, in terms of understanding the different commonalities, understanding as well the patterns from a genetic perspective or from different bioindicators, what is really the data telling and how much can help us to develop new molecules, for example. On the other side, on the rare diseases, takes more or less an average of more than 8 years to identify, to diagnose one rare disease to one patient. Why? It's not easy. It's like Dr. House, more or less, right? You have the patient in front of you, the symptoms, they are different, and it's not easy to understand the patterns there. Might be confused with another possible disease, right? Then automatically you start prescribing something that is not indicated to that specific rare disease. Now, technology there can help us tremendously as well, and it's being used already. Now, from an operational workflows, we touched already a couple of times here with other speakers in terms of traceability, serialization. Every time we have products that are extremely sensitive, imagine vaccines. On the gene therapy, for example, where we have the cold chain management, where the temperatures, they need to be respected, controlled, but also in terms of having that serialization traceability, understanding that that product was coming from a manufacturing site, from one country, and goes to another one, and if there is a breach, if there is a quality or safety issue, you know exactly where the product is coming from. Now, we go again to that big discussion that is not going to be easy, and I would say I'm a big supporter of networks, of communities, discussions like this, that will allow us to understand what might be the hybrid sweet spot, right? What might be that single middle point that can help us to really understand in an hospital environment, for example, how much can we centralize, how much can we decentralize, and how much can we release data components in terms of allowing us not to have the full patient story, but only the protected, encrypted, and anonymized data that is relevant to do a validation or a check. So, in some way, another key parameter here is whatever we do from this side, we need always to comply to several different regulatories and compliance policies that mandates, or the ISOs, the standards, on the 27001, 9001, on the cybersecurity side, and so on, but especially in terms of the GDPR, the data protection, and of course the internal policies on the hospital's environments. And every time we implement something new, we implement, even if it is a small language model, even if it is a specific model to help us to make recommendations or to advise us on the clinical decision support, we need to understand as well what might be the liability, what might be the security, and the safety of what we are implementing in terms of, again, the data protection, right? On the other side, the standards they are always on the top of the mind of every healthcare professional. Why? Not only the systems, but the procedures from an hospital perspective, they need to comply with those specific standards. Now, this comes exactly, we know, we have been discussing over the last couple of years, how much we need probably to implement the technology, how much we need to have the data controls, the data protection, privacy, but what about the human capabilities? What about having the skills to allow the healthcare professionals to perform a specific task? And that specific skill might be critical, might be a critical thinking from a clinical side in terms of understanding what the X-ray is telling us, and then automatically making a decision to prescribe something or to put that patient in a therapy, or might be a joint effort of different capabilities that goes on an organizational level and goes on the individual level. And that automatically, it's going to put more pressure on the hospitals to do something that is critical right now. It's not AI, it's not blockchain, is resources management. So having the hospital the ability to manage effectively the costs, the available resources, and the capabilities from the organizations and the healthcare professionals. And it's always that symbiotic overview in terms of the technical capability, how much they need to implement the structure on the technology and the data side, but also on the organizational side, on the organizational capability. And even then, breaking the silos. Because the hospital can be extremely complex when not only you have the processes and the operations with pharmaceutical companies, for example, but then even internally, how they effectively manage the different departments and the different procedures that sometimes each of the departments, they speak a different language. And that is not a valuable, positive situation, can be quite complex when you start integrating data and systems, even inside one single hospital. When you start asking to integrate certain data points with another hospital from another country, because we travel as well, we might go from Switzerland to Germany, and the data will need to go with us as well. Automatically, that comes the integration challenges there. Now, if you see right now, from the left side to the right side, what we are actively already doing, it's implementing regulatory sandboxes in terms to validate, to test the data models, especially to start implementing actively semantic and ontology layers that not only have the protection layer from blockchain, for example, with the zero-knowledge proofs, or the encryptation, but also in terms of the semantic to allow us to make the connections. And AI is being transformative there in terms of allowing us to really match and find the commonalities within the different data sets. And even when you start going from one country to another, even if it is in Europe, the data classifications regarding diseases, diagnostic activities, or even prescriptions, they change massively. So that semantic layer, it's critical. On the other side, again, the scale frameworks is something that is extremely important as well. Why? The scalability automatically will only exist if the protection and the safety and the governance really exists. And automatically, we need to develop as well the non-intrusive monitoring of these systems and the different data frameworks and the different data architectures as well. Now, from an evolutionary perspective, in terms of where we might go from an healthcare side, we need to think also in terms of, again, what are the human capabilities that we need to help the healthcare professionals to develop in order not only to have more digital literacy, but also to understand how much the data might bring complexities, and even when they are making decisions of sending a prescription or one electronic healthcare record to one system to another, they need to understand as well what are the sensitivities and the nuances of the data so they can understand the risks. And until we have a point that we might have clinicians that don't fully understand the technology as well, the communication with the patients, that is changing because the patients are becoming more demanding as well in terms of the discussions and how much they need to challenge the medical activity as well, the medical diagnostic, then automatically the doctors will need to have a better understanding also of how the data is being managed, stored, protected, and the privacy as well. Thank you. Hey!